Today's topic is about watching your health. Now, I watch my health every single day, and I've been healthy for at least maybe 6 or 7 years now, ever since my last surgery. Um, just in a few months or so, I do have to get my wisdom teeth out. That's the only thing health wise that I need to get really fixed. Um, Otherwise, for the viewers, I want to tell you a few tips to help you watch your health and help you um, like cope with your health and stuff like that. So we're gonna talk about coping with your health, helping your health, watch out for your health, and that's about it. So let's start with coping with your health. So, what's a coping skill? A coping skill is basically a mental skill where you think of, and my coping skill, if I'm getting stressed or have anxiety, I listen to music or dance or basically write down my feelings or something like that in a journal. Or that's what I do for a coping skill. Some other people can go out, hang out with friends, exercise, watch a movie, read a book, um, listen to music as well, do some creative activities dancing and stuff like that for a coping skill. And so, what you can do if you're having anxiety, or if you're stressed out of something, or if you're even in college or high school or middle school and you're just really stressed out at work and stuff, you can always be ask a teacher, or you can ask a friend to help you, because I'm pretty sure your friends will probably help you. Or you can use one of your coping skills, figure it out, and listen or you can even, the majority of the teachers in society would stop after class, or during class, if the class is at a quiet time in a part of time, they will mostly talk to you and be like, okay, so I noticed that you haven't really fully understand what we're doing. I can talk to you and help you with the work after school, or if the work after class, you can come in at lunchtime. That's what they will basically say, technically. And so that's about coping skills. Went on to the next one topic, watching your health. So, watching your health is very important. If it's a skin rash that has been small for a while, and you just finally notice that it's been growing a lot, or getting worse for some reason. For example, when I was 17, true story, I had the shingles, and it was during the winter time, and I was in the bath in my mom and dad's room, and I looked at my knee, and I was my leg, and I was like, what the heck? What's that? And my dad's like, that's probably a bug bite, but we can get it checked. And so we forgot to get it checked, but it kept on getting worse and worse. And so then finally we went to the doctor's office, and the doctor was like, yeah, you're gonna have to send Sean up to Stanford right away. He apparently has shingles. And I was like, what? This is bull crap. That I can't get shingles. That's for 60-year-olds. Well, you can't. So it's very rare for young people to get it. I think, if I remember it correctly, don't quote me on this, but it's 1 in 100 people age 20 to age 18 to 35 or something can contact shingles. I was one of those special ones. And or if there's a bump on your head, or a bump anywhere on your body, or or you had like been having these flu symptoms, or your behavior's been acting strange, it's important to get that checked as well. Or if you have been having seizures and you haven't had history of seizures or something like that, it could be like something with your brain or your vision or something like that. That hasn't happened to me, but I have had seizures before, but I'm all done with that for now. Cross your fingers that doesn't happen again. So it's very important to look out for things that is different on your body. This technique is called self-awareness and self-evaluation. So you look at yourself, make sure everything's okay, and then the second thing is how to get help. So you can get help by asking a doctor, importantly, or your parents if you live with your parents still. Like I live with my mom still, and so you can ask a doctor, your parent, a friend if you don't live with your parents anymore. You can ask them to go with you to a doctor's appointment or something. Or you can even, if you have a parent guardian or trustee, like parental, parent figure, like maybe a teacher, you can ask them to give you a ride or something to a doctor's office. But yeah, not saying that you should. If you're old enough, like if you're 18, 19, 20, beyond that, it's important to ask a close adult, not like a teacher or something like that, like an actual family member or parental guardian, like either if it's like a fairy godparent, no, like a guard parent, I don't know what it's called. You know what I'm trying to say, hopefully. You can ask them, but if you're younger, like 17, 16, it's kind of inappropriate to ask a teacher or somebody that's not in your immediate family, or a friend in that example too. So this is just my review and topic of discussion. We are now still videotaping in my room until I get a fake studio. This is my fake studio. By the way, I can't get a studio unless I buy a house. But otherwise, so this is a topic of like watching your health. So make sure you do that. And if you have any comments or questions, leave your questions and comments down below. And now I will definitely answer them like ASAP, as soon as possible. I'm usually not busy, so like you can text me or like comment me down below anytime you want, and I'll get back to you when I can. And thank you. If you like this video, make sure you subscribe and like it, and push the bell button down below so you can get notifications for new videos. Now and then since I'm back in America, I was in Mexico last week, I'll be videotaping, vlogging a lot more now. So yeah, and also feel free to look up every video that I post in here, and tell your friends about this channel, because I need the subscribers. It'd be amazing. Thank you, and bye.